Hello all, this is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist, and today I would like to tell you a very important topic. When you're choosing a hospital, whether to go with a hospital which has a good caseload or to go with a hospital which has a very good academic classes and journal clubs happening. So which one is better? So I would like to answer that question. So I would like to answer that by reverse engineering what is your end goal that you need to achieve. Okay, so for me, your end goal should be a successful anesthesiologist or a successful doctor. To become that, you need the three pillars which I have explained in one of my videos which I have done recently in designing the future. So you need to have the hard skills, you need to have the soft skills, and you need to build a CV. So these are the three pillars which will decide whether you're going to become successful or not. And when you apply for a Middle Eastern country or when you apply for some other country, these are the things that they would be seeing. So to build this kind of profile, so which center suits you better is what we have to understand. So for example, a government college, if you take up, you might get a very good caseload. Okay, you might you would see a lot of complex case management. So a person passing out of the government hospital, I would assume that they would be more confident because they would even leave them to start cases independently from second year or third year onwards. So they come out very confident in the case management. But what they would be lacking is soft skills. The way they talk to people and everything looks slightly rough. So that angle they need to improve. And also a part of CV will be built in government hospitals because government hospitals usually have people, assistant professors and associate professors, they will have some kind of compulsion, for the promotion's sake, they have to do some studies. So they usually involve the residents in doing the studies. So you might end up doing one or two publications in the process, and they will make you present your thesis or some other topics in the conferences. So some part of CV will be built in government hospitals, but they would be lacking in the soft skills. At the same time, a person who is trained in a corporate hospital or a private medical college, the case load might be not as good as the government hospital, and also they would not get a free hand like in a government hospital, and also independent starting of cases most likely wouldn't be given in a corporate hospital because always a consultant will be there in the beginning and ending of the cases. And in complex cases, even during maintenance, consultant will be there. So the confidence level of the students who are passing out of the corporate hospitals or private medical colleges would be lesser than government hospitals. But there, in the corporate hospitals particularly, the residents who are studying, they would develop soft skills because they would be seeing the consultants talking to the relatives, how they are actually explaining the risk and how they are breaking the bad news. So they would be watching and observing the consultants, and slowly they'll imbibe the soft skills. So people who pass out of the corporate hospitals, we usually assume that they would be good in the soft skills, but they lack the confidence which they will build over a period of time. But the CV part, I'm not very sure with the corporate hospitals because most of the consultants in the corporate hospitals, not everyone, but most of them wouldn't be having any kind of compulsion to do a research or they have to present in every conference. So most of the times people who pass out of the corporate hospitals would not be doing any research, and they might present in one or two conferences, but most of them even wouldn't do that also. So the CV part will be weaker when you come out of a corporate hospital. So after finishing your post-graduation, when you join a hospital or any hospital, I would suggest you to build the skills which are lacking. Okay, for example, if you're passed out of a government hospital, then what you need to build is the soft skills. So you have to work in a corporate hospital and build that area. Okay, and if you're passing out of a corporate hospital, and what you need to build is you need to independently start cases, and you need to get a lot of hands-on, and you need to learn how to publish and those things. So for that, you have to work with you have to work in a place where good mentors are there. Okay, then if you ask me, then how do we find where a good mentor is there? Okay, so for that, what I would say is you have to go into platforms like LinkedIn, or you have to ask your seniors or people who are already working in the field. Just ask them who is the best in that particular field. For example, if you want to enter intensive care medicine, or you're a pulmonologist and you want interventional pulmonology, just get some contact of person in a LinkedIn and have a chat with them in LinkedIn and ask them who is best in the country, and try to get their contact address and work with them for some time. In that way, what happens is when you work with best people for 1 or 2 years, they'll mentor you. And most of the time, the best people are very busy, and also they are into research activities, and also they're into a lot of presentations. So when you stay with them, they will push you and they will make you do the stuff that they are doing. Okay, so in the way you'll also progress and you'll build your CV. So that is how I think you should plan your college. And finally, if you ask me caseload or academics, if you ask me, the answer is not so simple, and different layers of understanding is there, as you understood. So hands-on and academics and soft skills and hard skills, everything you need to improve. So, but everyone would not get an opportunity to develop everything in that 3-year period. So you try to focus on whatever is best in that particular center, and then whatever you're lacking, you try to improve after your PG. That is how you need to practically deal this. Next video is about the hands-on when you get. Okay, I recently did a survey in my channel and I gave you multiple options. Which hands-on procedure do you want? Like a central line, arterial line, and intubation. Many of you chose intubation. Okay, like 70% chose intubation. And I would like to tell you which procedures you need to learn and everything in my next video. Okay, and I have also done another survey in my channel asking you hands-on is better or caseload is better, or everyone chose hands-on and independence. Yes, that is partly right, but what you need to understand is after 7 to 8 years of experience, everyone will reach almost similar skill set. Most of the anesthetists actually will reach a point where their hands-on experience and the way they handle cases is almost similar. What I am personally saying is the differentiation comes in the soft skills and the CV. So hard skills are like almost similar. Like after 7-8 years, everyone will know how to induce cases, how to induce a case of low ejection fraction, and also many people will know how to do fiber optic intubation, central lines, and maybe percutaneous tracheostomy is for maybe if people are working in parallel in intensive care might learn, others might not learn. And in neuroanesthesia, usually you learn that also. So you reach a point where you learn everything almost. So major differentiation comes in the soft skills. So I think you need to focus more on that if you want to grow in your career. So hope I answered your question. Thank you guys, and follow the videos for more information like this. Thank you very much. As usual, Dr. Dheeraj Masapu logging off. Roger that.